My name's Alex Chung. I'm a research fellow with the Health and Social Care Unit at Monash University, and I've been working with the Prevention Centre to undertake this exciting knowledge synthesis project. My presentation today is a collaboration for policy-relevant knowledge synthesis, translation and research, trialling new methodologies. I'm presenting this work on behalf of myself, Elia Howes, Helen Signey and Lucy Rycheknik. I'd like to acknowledge the traditional custodians of the land that I'm on today. That's the land of the Wurundjeri people of the Kulin Nation. I pay my respect to their elders past, present and of the future. The work that I'm presenting today is a knowledge synthesis of evidence for prevention in the first 2,000 days. The first 2,000 days is that period of early life from the moment of conception up to age 5 years. It's the formative years of a child's life, and it's an opportunity to set children on a path to health and well-being. This work has been undertaken by a collaboration that we call CERI, the Collaboration for Enhanced Research Impact. It's a joint initiative between the Prevention Centre and a growing number of NHMRC Centres of Research Excellence. The aim of CERI is to enhance the impact of prevention research and identify new ways to mobilise policy-relevant research. And that really underpins this knowledge synthesis, where we've worked together to bring research, policy and communications experts together to generate collective insights from current CRE and Prevention Centre projects, and in doing so, consider the implications of evidence for research, policy and practice. The knowledge synthesis process was guided by a number of objectives, and we followed a process developed by the Prevention Centre. With the first 2,000 days identified as a cross-cutting theme throughout the CERI member CREs, we first of all initiated a policy dialogue to map priority areas for policy partners within that scope of the first 2,000 days. This first policy dialogue was facilitated by Lucy Rycheknik from the Prevention Centre and brought together researchers and policy stakeholders from across Australia to identify priority areas for research within the first 2,000 days. These priorities informed the research questions that then guided our knowledge synthesis. Over a period of 4 months, I reviewed more than 70 articles from work conducted by CERI member CREs and also the Prevention Centre, and synthesised the findings of this in response to each of the research questions that were developed following that first policy dialogue. Our second policy dialogue, facilitated by Beth Stickney from the Prevention Centre, allowed us to discuss the findings that had been drawn out of the literature and consider the implications of these findings for policy and practice. This collective body of knowledge has shaped the research products that we're currently developing. The research questions were developed based on priority areas that emerged during our first policy dialogue. The questions guided the evidence synthesis, keeping in mind that rather than a traditional systematic review, the evidence that we drew upon was taken directly from CERI member and Prevention Centre projects. The research questions were as follows. What are the benefits of prevention in the first 2,000 days? Or how can we really make a case, make an argument for prevention in this early stage of life? Secondly, what prevention interventions are effective and cost-effective? Thirdly, how do we support implementation and scale-up of effective interventions? And finally, how can we tailor interventions to meet the needs of priority populations, which in this case were identified as Aboriginal and Torres Strait Islander people, culturally and linguistically diverse groups, and people experiencing socioeconomic disadvantage? These questions provide great insight into what policy partners want to know when they're looking for evidence to guide their work across the first 2,000 days. The key findings were developed following our examination of the research evidence, as well as the conversations that we had in that second policy dialogue around the implications of this evidence for policy and practice. The key findings include the first 2,000 days presents a window of opportunity. There are economic benefits of investing in prevention. There are effective and cost-effective interventions available for preventive action in the first 2,000 days. Prevention in the first 2,000 days can reduce inequalities. There is public support for prevention, and particularly for prevention that improves children's health and well-being. And finally, implementation and scale-up requires collaboration and a shared vision between partners. The communications experts at the Prevention Centre are now working to generate research outputs that pull out the findings of this work for policy partners. Things like findings briefs, evidence reviews, and fact sheets will highlight key messages in each of the priority areas that have been identified through this process. We'll provide links to relevant supporting evidence and a suite of tailored resources that can be used by policy partners. I'd like to thank the policy partners, the CRE teams, and everyone at the Prevention Centre who's worked together on this novel approach to knowledge synthesis. This project really demonstrates the potential for bringing research experts and policy partners together to effectively translate research for policy and practice.